welcome to the Global Health video class. My name is Dr. Elvira Beracochea. I'm the President and CEO of RealizingGlobalHealth.com. And we are talking about a very important approach that really can change global health when it's applied to every country consistently. So I really want to encourage you to join us in this movement that will bring Six Sigma to every country everywhere, because we really need to reduce the number of errors that we make in global health. We need to reduce the number of children that don't get their immunizations, the number of children that are not diagnosed and treated properly, the number of mothers that are not delivering their babies under the proper conditions. We need to end the number of patients that do not get their medication or have to default on their treatment because the medicines are not there. We need to make sure that every patient gets the same quality of health care that we get in any country in the world, everywhere, every day. And how do we do that? We do that by applying Six Sigma, which is a methodology that I have adapted to make sure that we make the effort to consistently deliver the highest attainable standard of quality health care to everyone, every day, everywhere. How? By putting procedures in place, by putting standard operating procedures that are based on the epidemiology of the region, that are evidence-based on the recent and most up-to-date medical information, and that are patient-centered. We have to remember that we are working with human beings, and we need to treat them as human beings. They deserve the respect and the dignity that anybody does, because it's their human right. And today we're going to talk about how health professionals, how we global health professionals working in governments and NGOs, in foundations, working in a hospital, in a clinic, can do. What can we do to make sure that we deliver quality health care, but not just quality, the highest attainable standard of quality health care to everyone, everywhere, every day? And we do that because we start with a project. A project is designed to change the country's programs. We know that programs are vertical to address different health problems. For instance, it could be HIV/AIDS, it could be malaria, it could be maternal health. Each country has a number of programs, and then those programs are translated into services, and those services are translated into delivery processes. So remember, the sequence is project, programs, then those are translated into services, and those services then need to be delivered in a certain way. There has to be standard operating procedures to make sure that then every day, everywhere, no matter where we are, the same quality of health care is provided to every patient. So remember, we talked about Six Sigma. We talked about the importance of reducing errors to less than 3.4 per 1 million opportunities. We talked about the process of assessing, measuring, preventing, and making sure that we control how services are being delivered. And we talked about now how we can change services that are not up to standard. We started with a project that is designed to improve how that program in that country is working. Then that program needs to be translated into services, and the services need to be translated into delivery processes. So I'm going to be talking more about those things in the following videos, but I want you to remember that sequence. So look at the projects that are taking place in your country or where you're working. Are they really improving the country's program? So if you're working in malaria, are all the projects that are working in malaria really improving and impacting those areas that really impact the quality of health care in your country when it comes to malaria? And are those services patient-centered? Do they really meet and impact the bottom line, which is the malaria rates in the country? And how is that translated into services? Because we don't just treat people of malaria. They come with other things. They have other needs. It's not just treating malaria. So it's important that we address malnutrition. We address other factors that may be influencing that condition. And the underlying social determinants of health are just as important as the bug that is causing the disease. And then look how we can deliver. The delivery processes is where sometimes I've seen that breakdown is when actually comes to the time. I've seen, for instance, providers that diagnose and prescribe, but then Now make sure the medicine actually was taken. Even the medicine was available and the patient was able to access the medicine. So think about how the projects in your country are improving the programs. Those programs are really creating services that meet the needs. And then the actual delivery process is according to the standards. So with that sequence, I think you're going to start doing a lot better, and you're going to start doing what really is required to help realize global health. I wish you the best, and I'll see you next time with more Six Sigma in global health. And take a next time. Bye-bye.